So next question is, why Lyme disease such a controversial topic and diagnosis, treatment so challenging? So, I'm an infectious disease specialist, and I was involved early on with the HIV epidemic. And so back in 1981, when I completed my training and started my medicine and pediatric training, we had all these gay men and children with these mystery illnesses, these immunodeficiencies. We didn't know what it was. We thought the children were damaged because of the injecting drug using mothers. We thought the gay men had immunocompromised because they were sniffing amyl nitrate, all of the chemicals that they were using for chemsex. We didn't really know what it was. And it took until 1984, until 85, till they could actually isolate the virus and then develop an antibody test. So that was the great challenge. But with HIV, the amount of virus that's circulating in somebody who's HIV positive is in the range of 100,000 to 1 million. In fact, children with HIV sometimes have 27 million copies of virus circulating in their blood because they have an immature immune system. Adults with HIV in the setting of acute seroconversion have 1 million. So it's easy to do a PCR on people with that diagnosis. But the challenge is that we didn't know what this mystery illness was, but when we actually set technology to coming up with good diagnostics for HIV, we were able to come up with good diagnostics. We came up with PCR testing, we came up with antibody testing, and I would say that you can PCR almost 100% of people who are HIV positive, and you can get antibody tests in 99% plus of people who are HIV positive. However, that is not the situation with Lyme disease for all the reasons I've said. The number of copies of Lyme bacteria that are in your system are in the range of 14 to 20 copies, tiny numbers. So it's very difficult to PCR. And then there's lots of situations where you don't make an antibody against Lyme. So this is the controversy. You can have a clear tick bite, you can have a rash, you can suspect Lyme, and then people have very strong opinions saying you must have a positive antibody test to make the diagnosis of Lyme, and people are denied treatment. People will additionally say that Lyme doesn't persist, that the Lyme bacteria, 6 months after you get it, even if you don't get treatment, will spontaneously disappear. And indeed, the Irish guidelines, draft guidelines that I was asked to review about a year ago, had included in that even without treatment, the Lyme bacteria, the spirochete, spontaneously disappears. Now, the other bacteria, which is called syphilis, the other great imitator, if you don't get treatment for syphilis, your ulcer disappears, your rash disappears, but the bacteria stays in your system and reactivates 2 years later, 5 years later, or 30, or even 50 years later. It disseminated from the ulcer and it lay dormant in your system for years and years and years. Initially, your antibody test might be positive, but with time, your antibody test goes negative for Lyme. When you do a spinal tap in people with neurosyphilis, the antibody test is often negative in the CSF. You can't isolate the virus. You can't isolate the spirochete in the spinal fluid, but we have models for diagnosis and persistence of infection for other spirochetes, from leptospirosis to syphilis, and Borrelia is no different. So we have limitations in the current testing, we have uncertainties in diagnosis and treatment, and it is a huge challenge. People believe or don't believe that Lyme persists. There are good studies that have been done now, research studies by a group from the University of New Haven, a lady called Eva Sappi, where she has been able to culture the Lyme bacteria, even at the end of treatment, from blood and from other fluids at the end of treatment. And there are studies where patients have been treated for long courses of antibiotics for Lyme, who improved clinically, and when the antibiotics were stopped, they actually had relapse, clinical relapse, and research studies have been able to isolate the Lyme bacteria from before treatment. At the end of treatment, the Lyme bacteria was gone, and when they stopped treatment for a period of 6 months, symptoms came back again, and they were able to cultivate the Lyme bacteria again, both by PCR and by actual culture, so indicating live replicating Borrelia. So this is the challenge. We've not been able to do good studies with Lyme because people have strong opinions that there is no such thing as chronic Lyme. The patients that we see with Lyme disease have often had their symptoms for a long period of time. They've gone to see one specialist after another. None of their bloods look particularly abnormal, and other specialists, whether it be gastroenterologists or cardiologists or rheumatologists or neurologists, already have made up a diagnosis on these individuals, and they're already put into that category of disease. So what is chronic Lyme disease? This is the challenge. It's not just an infectious disease, it's an inflammatory disease, it's an autoimmune disease, and the Infectious Disease Society of America back in 2008 basically said that you receive 3 weeks of antibiotics. Back then it was actually 2 weeks of antibiotics. And if you're still sick, it's post-treatment Lyme disease syndrome. No other infectious disease in the world is characterized that way, in my opinion. I'm a clinician, I treat patients all the time, and I try to minimize my duration of antibiotics, but if I have a patient with a cellulitis, guidelines say 7 to 10 days. If the patient has lymphedema, if the patient's a drug user and is injected into the groin, has no lymphatic system, they don't clear these infections. Sometimes you have to go 10 days. Sometimes you have to treat 21 days until the cellulitis is treated. So post-treatment Lyme disease syndrome was a coined term back in 2008 in that time period. And people continue to say that if you treat somebody for Lyme disease and they have persistent symptoms, it's post-treatment Lyme disease, implying there's no longer residual infection. But people have actually done further studies, not good studies, because nobody's done a good study in Lyme because you don't get funding for a disease that doesn't exist. But many of these studies show that when you treat people, they get improvement in their symptoms, but not all of their symptoms, and then sometimes the symptoms relapse. So this is the challenge of Lyme disease. There's lots of arguments. Is there residual infection? Is this just a purely autoimmune disease, or is this just post-infectious inflammation? And the reality is it's probably all three. And in some situations, there's persistent infection. So I've changed the term PTLDS, not post-treatment Lyme disease. I've decided that P stands for persistent Lyme disease, or possibly partially treated Lyme disease, because in my experience, some patients who have been treated for Lyme, who got better on short course treatment, then relapsed when the antibiotics were stopped. My clinical assessment is the antibiotics were doing something, and they've got relapse of infection, and they should be treated again. So I think some cases are indeed post-infectious, some cases are persistent infection, some situations are partially treated infection. So this is the challenge of Lyme disease that we're dealing with. There's lack of good data, lack of quality research studies, but clearly for early infection, I think the GP should be on the front line, making an early diagnosis and getting people on treatment early. If you've got patients who come in years and years down the way with persistent symptoms consistent with Lyme disease, if you look at the guidelines, and the guidelines say treat for 2 weeks or treat for 3 weeks, I think at 2 years down the line, it's going to be very difficult to eradicate a chronic persistent infection with an antibiotic regime that's only made for acute early infection before dissemination has occurred. But there currently are no guidelines for treatment of chronic Lyme. So the patient's in a very difficult situation. And the NICE guidelines currently say there's no such thing as chronic Lyme. They refuse to even consider the concept that there's chronic persistent Lyme infection. However, the Americans put together a task force, a public health task force on Lyme disease, and they have in their documents acknowledge the presence of chronic persistent Lyme disease, but unfortunately they haven't come up with any recommendations on treatment. So we're all in a very difficult situation, difficult for patients especially who have persistent symptoms, and it's difficult for GPs and doctors who are told to follow the guidelines. But patients do not always follow the guidelines, and there clearly needs to be better research, better studies to look at treatments to understand the combination of infection, inflammation, and autoimmunity in these conditions, and clearly the need for specialist Lyme disease services and multidisciplinary services need to be developed throughout the world, because this is a complex infection and it's never been well studied.